This conference will now be recorded.
Okay, we're being recorded. I'd also like to ask everyone to please mute your microphones on your computers or your phones. This will help to eliminate background noise and distractions for the presenters and for all the participants. We will be having questions and answers following each presentation. You can enter your questions in the chat box on your GoToWebinar screen, or if you would like to submit your questions anonymously, there is a number on the screen where you can text those questions. We will be putting resources from today's webinar on the TMACOG webpage. So I will provide a link to that in the chat box, and you will all be able to access the agenda from there. So in a few moments, you'll see that pop up. We'd also like for everyone to put their name, affiliation, and if you'd like us to contact you with resources after the webinar, your email in the chat box. So you can start doing that right now. And this is how we're keeping attendance for today's meeting. I want to make sure I'm not forgetting any announcements, so bear with me. And actually, I think that is about it. I'm going to go ahead and hand this over to Sarah, who will be moderating today's event. And we hope to have a great conversation with all of you. And Sarah, I'm going to hand it over to you.
All right, thanks, Kari. So I'm Sarah Helbig. It's great to have so many people joining us this morning. I'm the Executive Director of Marketing at Jones & Henry Engineers. I'm here as a representative of, a supporter of TMACOG, not as a representative of Jones & Henry Services this morning, but just to show that we proudly support TMACOG's mission to enhance our region. When Kari and I were talking about preparing for the water and wastewater training we sponsor annually with the group, with everything being held virtually this year, we really wanted to have an event that would be meaningful to all of our membership in the region. So we thought having a discussion on COVID-19, which everyone's been challenged with kind of dealing with this spring, would be a great way to kick this off. So this is just that. It's a nonpartisan roundtable. We're recognizing that we're literally all in this together. Everyone's got perspectives, and so we've got some great leaders from our local communities that have stepped up to say, here's how we've been handling things. So we're excited to share that with you today, and we really welcome everyone to participate and enrich the discussion. So 2020 is a lot of unexpected challenges, but our region, as you all know, and this is a time for us to share in an effort to help one another through the impact that the coronavirus has had on our water and wastewater resources. So we welcome your interaction today. We will hold some Q&A after each of our sessions. We've kind of broken this down into 4 sections, and we've got 4 different people to share some different perspectives with you. So the first one this morning, we'll be hearing from Chuck Campbell, who's the project manager with the city of Toledo. And not to downplay all of his experience there as a project manager now, he was also a former commissioner of plant operations up till 2017. If you don't know him, he has 32 years of experience in water, wastewater, environmental protection, and safety, with a number of different positions included in there. So with that, he was commissioner of sewer and drainage, and then also with water and wastewater plants. He was a supervisor of operations at the Toledo Water Reclamation Plant, safety and training specialist for the Department of Public Utilities. He was the chief of water resources, and also was a wastewater plant operator and laboratory analyst. So Chuck, also from an academic experience standpoint, was a former adjunct professor at the University of Toledo, Owens Community College, and also operator training committee on the Ohio on the subjects of wastewater, HAZWOPER, I don't even know if I might have butchered that one, Chuck, general industrial and environmental problems. He also has certifications in hazardous materials manager, a master's level, He has his OEPA Class 3 operator wastewater works, OSHA 10 to 30 hour authorized instructor, and he's also a certified OSHA instructor. So Chuck just has a tremendous amount of experience, and the city of Toledo is lucky to have him on board to help navigate some of the unfounded challenges that have happened this year. So I will turn things over to Chuck. He's going to share some workplace protocols and some resources that he thinks may be able to help some of the other communities in our area as well. Thanks, Chuck.
Thank you, Sarah. Is my slide up?
Yes, it is.
Okay. We're going to talk about pandemic plant safety and preparedness today, and it's going to be a very general overview. We have a short amount of time, and each one of these subjects could be expanded on later. And I think Kari is looking at the possibility of putting together 4 credit contact hour courses later on, where maybe we can break out some more of these and get a little bit more in depth on them. So here we go. A little overview today. We're going to talk about this is what we do, the basics of plant COVID safety, our preparedness efforts that we need to take, and some resources, and then save a little time for some questions and answers. So, this is what we do. All of us are public sector heroes, and we've been doing this for a long time, a couple hundred years, 24/7, 365. When typhoid and cholera and polio and all these other diseases came around in the 1800s, it led to better sanitation, sewage and wastewater and water treatment, including chlorination came around a turn of 2 centuries ago. Then Milwaukee, unfortunately, ran into cryptosporidium back in 1993. They had almost 100 people die and hundreds of thousands infected. That led to improved treatment. It led to a new monitoring rule. Unfortunately, in 2014, Flint ignored the lead and copper rule, as we know, and there was lead poisoning, in particular to their children, a horrible neurotoxin. And although unconfirmed, they did have a Legionella outbreak in Genesee County in the Flint area. It wasn't confirmed to be tied to Flint, but another waterborne disease. Then 2014, right, we got hit with our microcystin do not drink advisory, which led to new treatment techniques and new rules that we all have to follow. So we've been disinfecting and killing pathogens for a long time to protect public health in cooperation with all the other agencies. Also, let's not forget what an excellent job that Eric and Dave and Shannon and everyone else over at Toledo County Health Department have been doing. Way to go. Patika's going to cover a little bit more on our interactions of this subject. And don't forget that you need to interact with them. This is not just a water, wastewater utility issue. If you do have an infection, there's a lot of procedures that need to be followed with Toledo-Lucas County Health Department. And I'm going to talk about points of dispensing that we need to work on when there are antiviral medications, when we do have a vaccine, maybe when testing comes around, how we operate our points of dispensing, our pods, and that's community immunity that's going to be handled through Toledo-Lucas County Health Department. So they're a major component also. Let's not forget what a great job they've been doing for the last few months on this. So let's talk about our systems. Are our systems safe? Water, yes, is safe. As of March 12th, right off the bat, EPA recommended Americans continue to use and drink tap water as usual. COVID-19 has not been detected in drinking water. And again, that's what we do. We are very good at destroying pathogens and activating pathogens, producing high quality drinking water. Our wastewater plants, how are we doing there? Well, CDC is reviewing information as it comes in. We know that we get in pathogenic organisms. And again, that's what we do. We destroy pathogenic organisms and make sure that we provide sanitation and public health. So as of today, has COVID-19 been detected in feces? Yes, it has. Has it been detected in sewage? Yes, it has. It is very short-lived. We get great log removal just through primary and secondary treatment at our wastewater plant. And once you start the disinfection process, it goes even further. So there is a risk of transmission through sewerage, although it is very low but possible. Patika is going to talk about cooperation on that later, again with the health department. So our current disinfection is effective, and there is no additional protocol recommended other than what we've been doing that has worked for all the other pathogenic organisms that come our way that we destroy. Okay, how about our employees? Well, the state of Ohio has done a pretty good job with that also. Dr. Amy and the governor and lieutenant governor, I think we all had our 2 o'clock, it's time for wine with DeWine, and we would watch our Restart Ohio and see how things are going and look at the data. So the responsible Restart Ohio for manufacturing and construction kind of fits in a little more with us at the plants, although there are the other 2 guidance documents and instructions fit very well for office and other work environments. So, we should be taking our daily symptom assessments. I came in this morning with Calvin, and right away we went to go see Cindy, and Cindy took our temperature. We kind of look at each other, we see how we're feeling. Is everybody doing good? If you have a cough or trouble breathing or any other symptoms, you're not supposed to be at work. You either go home or you stay at home if you wake up and you're feeling like that. I think it's important too to start taking your baseline temperature. I'm always a little cold. I'm on the 97 degree side, not so much the 98.6. So having a baseline temp, whether you're a little hotter, a little colder, is important. And watch out for the asymptomatic. So we all wear our masks, right? And we wash our hands and we do all that. So then work along again with your local health department guidance on how you're supposed to handle potentially infected or exposed individuals. And when you do, then they need to go into the contact tracing and the notifications and testing, and then follow out their procedures also. What do we do at work? Well, we follow the mandatory and recommended best practices. Social distancing of 6 feet. We've all heard the hand washing. Use your sanitizers. This is what is the new normal. Physical workspaces need to be adjusted. Workstations need to be adjusted. If you can't get the social distancing, we put in barriers, right? PPE, gloves, and masks. Masks in particular, Ohio Warren, which I'm going to touch on later, the Water and Wastewater Agency Response Network, got FEMA grant and masks, and we were able to dish out to water and wastewater treatment plants only for utilities. The masks that are very nicely made by Hanes. They're a very soft, comfortable material of cotton and some spandex. It's got a silver and copper interwoven fabric in there too that does have some antimicrobial properties to it. And Ohio EPA sent out a blast to all the operators of record or responsible people at the different utilities. So you should have saw that. You should have got your masks. We do have some in reserve. So we're probably going to be doing a second round with that on Ohio Warren. If you're going to get into, you should look at your job safety analysis and see what tasks you're performing. Do you need Tyvek? Do you need an N95? And do you need a shield? We do have those in our storerooms, and we do use those in our processes at the Division of Sewer and Drainage, water reclamation, water treatment, maybe environmental services out sampling sewers. So if you're going to be in an area where you're getting that aerosol built up, not only do you want to use the proper PPE, but train on your donning and doffing and decom procedures to make sure that you're handling that correctly. Other ways that we make ourselves safe: stagger or limit the arrival of employees. Employees should be working from home if possible. No unnecessary visitors or travel, and take the proper protocols when you do have visitors or contractors coming in. Have those discussions ahead of time and work out the protocols. So, what do you do with your shift workers? Well, having that operator of record, having those operators to run your plant is extremely important. And we've, here at the City of Toledo, looked at changing our shift patterns, not only for operations, but maintenance, laboratory workers, all our essential and needed employees. Sometimes we did fewer shifts, sometimes we staggered shifts. 2 weeks on, 2 weeks off to have a reserve of employees. Should the incubation period for the virus kick in, you have a reserve of employees. Tried the 12 on, 12 off. So prepare to stagger your shifts, be flexible, and write that into what we're going to call our continuity of operations plan that we'll touch on in just a minute. You have to, some spaces need to be adjusted and allow for distancing, and you have to establish maximum capacity, try and reduce where you can. We also split into sub-teams and limited contact across those sub-teams that work together and have to interact together. As we all know, we're doing things virtually now and not so much in person. So then the routine and regular cleanings and daily disinfection that has to be done for every facility, along with your own personal space. If you have some wipes, if you have an EPA approved solution, there are EPA approved disinfection solutions that we should be using. And that's on the EPA website. I'll have a list of resources later on. So plant safety, plant treatment, employee safety. How do we take care of that? How do we plan for that? How do we make sure it happens? Well, we should be using our emergency management and preparedness techniques that we have. FEMA has a lot of different training that you can get. We're going to talk about NIMS just a little bit. You should have your National Incident Management System training at a couple different levels. And you should be looking at your emergency operation plans, your emergency action plans. So FEMA talks about emergency management in 4 different phases. You respond to an emergency. When you respond, that's where you take action to protect people, property, or the environment. Examples are you open your emergency operating center, you open your departmental operating center, you implement an emergency action plan or an emergency operating plan. And the difference there between emergency action and emergency action gets you going, gets you moving, gets things in place. Emergency operating is how you actually produce that product, whether it's treating wastewater or treating water to get it back out or from the public. Your collection system, your distribution system, your environmental system, your billing system, how you actually operate. Then there's the recovery period. Recovery is when you can restore back to normal operations. An example there would be going from utility power during a power loss and shutting off your generators, going back to your preferred power source. When you mitigate, mitigation phase is when you actually take action to reduce the impact. So it might not be right during the response phase, but you would go back and maybe you rebuild your dikes after a flood, which I know our Division of Streets and Bridges and Harbors has quite a job going back and doing their mitigation on our dike system. Then preparedness. We're going to talk a little bit more about preparedness. In the preparedness phase, that's where you're creating your plans, you're doing your exercises, you're doing your tabletops. And as far as preparedness goes, whoops, a little ahead of myself. So, and when we prepare our plans, we want to look at overall encompassing plans. And one of the most important is a continuity of operations plan, or a COOP. So when we got into this in March, we did not have a continuity of operations plan ready to go. So one of the first things I did was pick up the phone and call Ohio Warren and talk to Dana and say, hey, Dana, we don't have a COOP and we could use some help. And Dana said, well, that's great, and got us on to the RCAP webpage, which has a pandemic toolkit. So we were able to download a template for continuity of operations plan and get going on that. Not easy to navigate, not easy to create, not having one. So it was nice to have one right off the bat that you could use. You also have to do your vulnerability assessments. And US EPA, if you're on the water side, you have the, it's already kicked in. You have to do your vulnerability assessment. You have to certify that vulnerability assessment and report it that you're ready to go should you have any type of emergency that could jeopardize your treatment, your service to your customers, and producing safe drinking water. Emergency action plans, you need to have your emergency action plan in place. Not necessarily has to be the the most thorough in the world, but how do you handle a tornado? How do you handle a fire? What are your emergency contacts? And then contact the different agencies that you're going to respond with. So when you pull out your emergency action plan, it's not the first time you're calling the fire department. It's not the first time you're calling your emergency response contractor. Meet with them ahead of time. Get those numbers, make sure that everything communication-wise is smooth and easy to transition in an emergency. Emergency operating plan, again, how you actually perform your services. They can be very voluminous. It can encompass every other plan that you have, along with a good communication plan. And in that communication plan, you want to make sure that you have your pre-approved messages, at least a good draft to work from, so you're not thinking about what to say ahead of time. And it's always a good idea to contact your local media and have them work with the messaging and let them know who your PIO is and how to contact that person. So on to training, and you need to train on your specific plans. And one of the most important that you need to get out of the way is your FEMA NIMS training, the National Incident Management System training. We've done that at 2 levels for every employee in our department. We've done it at the 100 level, and the 100 level for public workers covers incident command, how the incident command structure works, how you function under incident command, how our incident command system here in our Department Operations Center functions, who those employees are, and where they're going to respond to in our own Departmental Operations Center, which had to be changed to a virtual Departmental Operations Center instead of the actual physical location. So that's something to throw into your plans also. The next level that we trained at was NIM 700. And the incident command system isn't necessarily the National Incident Management System. So in the National Incident Management System, instead of the command side, we start to take a look at your preparedness efforts, understanding them, more on communication and information management, resource management, command and management, and the elements and resources and interoperability that you're going to have with all the other agencies. So it's more the system itself, not the command structure on the 700. If need be, if you're running chlorine or you've got methane or some of the other extremely hazardous substances, you need to have your HAZWOPER training rolled in there. Even if your employees aren't going to respond at a higher level where they're actually taking aggressive action to stop a release to the environment, at least know when to back off and how to implement the plans and stay safe. Again, our EAPs and EOPs, along with your local safety forces and the media. You should also be including the local emergency planning committee, the local emergency management agency, Ohio Emergency Management Agency, and then with those agencies, you should be looking at your area plan and seeing where you fit into these emergency essential functions that have to be performed, be it for public service, transportation, or whichever ESF that you fit into. Then once you get your training down and you've got everybody ready to go, it's exercise time. So you can start with some brainstorming sections, maybe just do some drills like a tornado drill for your emergency operating plan, your emergency action plan. Then once you get past some drills, it's time to sit down and do a tabletop. Do all those simulated events in a fairly realistic location where you bring your incident command system together, throw a problem at them, have them solve it. And include these same agencies that I talked about before in your tabletop, so you know how to respond and they can see how you're preparing. Then you start to get into full-blown exercises where you're not just in a room at a tabletop, but you're outside. You deploy crews, you have staging areas, you set up your incident command, set up your communications areas, and make sure that you've got everything as close to real as it actually happens. Then afterwards, you need to hot wash all those events and sit down and find out what went right, what went wrong, and have everybody bring something to the table so you can improve and have your next response based off of the mistakes and the strengths and weaknesses that you had from your exercises. Again, preparedness, there's also support from all those agencies, from TMACOG, from the committees, from professional organizations, mutual aid organizations, and contractors. And I want to touch on Ohio WARN a little bit. So very important in our industry to become a member of Ohio WARN. It's the Water and Wastewater Agency Response Network. It's a network of utilities helping other utilities. And the mission of WARN is to support and promote preparedness and disaster response and mutual aid. It can be private sector, public sector, throughout the state of Ohio for any natural or man-made disaster that might hit you. You can get on Warren's website there, and I've got that later in my resources. To become a member of Warren, you log on to the website, you pass a resolution, you sign an agreement, and then you follow through with communicating and making sure that your profile is updated. There's a whole lot of paperwork that you can fill out should you need to borrow utility help or personnel or equipment, and there's a good tracking system for that in the paperwork. So if you have any questions, get a hold of Dana Moore, get on the website. That's right from the website. And we have not had a Northwest coordinator. So the regional coordinator position for Northwest Ohio is open. I told Dana I would fill in temporarily. And he asked me during this event, and I said, well, let's make sure we go back and ask everybody else. So you should be seeing a Survey Monkey come out if you're an Ohio Warren member, and I would gladly help to transition whoever wants to take over as the next regional coordinator for Northwest Ohio. That is about all I've got for now. I hope I did pretty good on time and saved some time for questions and answers. I also have some links I can provide. So see if I can get
Does anyone have any questions for Chuck? It was great information. I'm sure everyone's going to be utilizing the website. There is a link that Kari can share, and Chuck has assembled the different resources he mentioned in his presentation, and we've put that onto a web page from TMACOG so that it can be utilized by everyone.
Yeah, several of those links are the state of Ohio COVID, Toledo Lucas County Health Department, of course, OSHA COVID, US EPA has a great site, CDC has great sites, Warren, and also RCAP and Great Lakes Community Action Partnership has a great toolkit for utilities. You can find a lot of information there, including the draft of the Continuity of Operations Plan. AWWA and WEF have been having a tremendous amount of seminars, webinars, and resources on their website. And then Stantec, along with OSHA, has a good wastewater treatment safety web link too, but Stantec put out a real nice documented considerations for water and wastewater treatment related outbreaks, and they have a very good reference of their resources on that too. So check out the Stantec link also.
That's great. I did get a question that just was texted in. If someone has, and maybe this is more for applicable to some smaller communities that might be stretched for operators or resources, thinking about who knows what will happen the coming year, if they will have any other surges or anything like that. But someone asked, what if I lose too many operators to COVID and I can't operate the plant? Do you have any suggestions that you've researched for that, Chuck?
Yes, Ohio EPA has a web link and a form to fill out if you're going to have a compliance issue. In particular, if you don't have an operator of record, you don't have enough operators to run your plant. You can't just call them and say, hey, I can't run the plant. Go onto their web link ahead of time, and it's on here. Take a look at their suggestions, and their suggestions include get some backup operators of record. Now, you can do that in a number of ways. They actually put out a blast to operators of record throughout the state of Ohio who would be willing to go into treatment plants and work if there aren't enough operators. Mm-hmm. There's also Ohio Warren, and Ohio Warren is willing to share personnel, not just equipment. So, and you need to have those backups ahead of time and have a plan. Maybe contact some of those operators that are willing to contract out on record. Again, and talk to Dana at Ohio Warren and see what the sharing capabilities are.
Great, thank you. Does anyone else want to chime in and unmute with a question? Okay. Well, we'll also still have some time for additional Q&A at the very end today. So stick around, Chuck. You never know what might pop up as things percolate.
Okay.
Our
Thank
next
you.
Yeah, thank you so much for sharing all of that this morning. It's obvious that the city of Toledo has been well prepared navigating through all the challenges, and I hope that some of the communities, if they weren't able to join us today, can utilize this as a resource going forward as well. So appreciate that. We are going to hear next from Teresa Pollock. She's the Public Information Director at Northwest Water and Sewer District. And Teresa is a great person to join us between her media experience and some of the training that she's had from ODOT and FEMA throughout her career. She's going to just share with us a little bit, kind of looking back this spring at navigating the coronavirus in terms of their communications, some of the administrative issues that they dealt with, and also just staffing challenges, and give us a little peek behind the curtains from a utilities administration standpoint. So Teresa, I'll turn it over to you.
Thank you very much, Sarah. We are going to be talking about how we handled the crisis at the Northwestern Water and Sewer District. In just a few minutes, I'll get my screen turned over and hopefully be able to share with you a little bit about what we have done throughout the entire COVID-19 process. I'll give you, in case you're not familiar with, a little bit of background about the Northwestern Water and Sewer District. We are headquartered in Wood County, right off of 582. We currently have around 70 plus employees, and we have over 20,000 customers. We also operate around 431 miles of water distribution pipe, one water treatment plant in Macomb. We also have 9 water towers. And on the sewer side, we operate around 356 miles of water distribution pipe. And we also have 12 wastewater treatment plants. So that's a lot of different things. And I don't know if my screen is going to be getting shared. Hopefully it will. Can you guys see the screen?
Teresa, we don't see it yet.
Okay, I'm trying. Thanks for being patient.
There we go.
Hey, you're on.
Yay. All right. So I'm going to adjust my camera here. Excellent. Okay, so I was talking a little bit about the district and kind of what we have done. It's also important to, I guess, recognize the difference between how we are governed. There's many types of government. As you know, townships operate differently than cities, the county and state, the federal governments, they all operate separately. But what makes us special is that we're a 6119 under the Ohio Revised Code. So we are considered a special district. We are relatively a small agency. Here you can see before the COVID our employee picture where we have over the 70 employees. And our rates are how we, I guess, finance our agency. And that's going to come into play as we discuss some of those finances. We recently acquired the Henry County Regional Water and Sewer District. And we also have experiences in past crises, including the Toledo HAB crisis. And we constructed a business continuity plan in 2017. And we were able to follow that. I know Chuck talked a lot about all of the different preparedness measures that go into that, the toolkit, et cetera, et cetera. So once we started hearing about COVID-19, things became interesting at the district because, as I have observed in other organizations as well, not only here in the region, but across the country, and talking with them, how they handled the crisis was different. This is a snapshot of Friday, March 13th, 2020, a picture of our whiteboard in one of our senior management meetings. Every week, even prior to the pandemic, our senior managers in the operations department, engineering department, administration, finance, customer service, and IT, we meet on a weekly basis. And then occasionally we'll ask the middle managers to step in when we have one of the senior managers out in case of an absence. But for about a month leading up to the pandemic crisis, some of the managers did not think coronavirus was going to be an issue based upon some of the information or misinformation out there, while others knew that this had the potential to be something serious. The week of March 6th, we had met, not only we were starting to meet over once a week, but we had met several times that week, and then we had an emergency meeting in this afternoon. So I think we had probably 3 meetings just regarding coronavirus. And again, this goes back to the preparedness measures. And this was, I guess, our simplified version of the toolkit that we were going to operate with our management or crisis team, and a list that we had prepared for the discussion going on into anything from how we were going to handle our employees going into field operations, how we were going to handle the mail coming in from customer service, shutoffs, non-pays. Obviously, that was something that we had considered before the actual order came down. But this was something that was very important. And then we took a very close look at our employees, everything from time off, people dealing with the school closures and how they're going to take care of their kids, where daycare is going to close. What if their kids and family became sick? How was FMLA going to play out? Also medical admissions. And of course, we went into the PPE, how we were going to take care of that for staff hygienes. And I like the bottom one, work at home ? As we know, that became a pretty standard practice, not only here at the district, but across the country as well. We also looked at our essential services, how we were going to be able to maintain our watersheds, our public notices, how we were going to get those out there, and policy and public meetings. Now, it's important to remember that once we realized that the water was not contaminated and that we could protect our employees who worked in the sewer operations, that this was not necessarily, I guess, a water forward issue. It was more of a health crisis that impacted all sectors, not only of water, but of business, education. So everybody was dealing with this crisis on multiple levels. And this was our management team's attempt to kind of wrap it all into one and look at some of those issues before we decided to more or less get into the full swing of the pandemic. Here's a look at what we have as we consider one of the district's great strengths. Now, because we cover so much territory, and you could see in the picture here, we cover the majority of Wood County, then we also have the small village of McCollum and Hancock County, and then we also currently had just acquired and merged with the Henry County Regional Water and Sewer District, so we cover areas of McClure all the way out to County Road P in Henry County. So we rely a lot on technology, and we have prior to this pandemic. We use our SCADA monitors and wastewater to make sure that we can monitor different treatment plants. So we use that in addition to our operators to help make sure our operations run smoothly. We also use it after hours for emergency, and our extensive GIS system built for asset management is very helpful, so that any of our employees that are on duty can be able to look at our entire system on an iPad to be able to assess what's going on, where we're getting alerts at, et cetera, et cetera. So this was one of our good advantage, and you could say we had a good practice of strong technology going into the pandemic. Now, once the orders were issued, things really changed. So once we had the stay-at-home orders issued, it became more of a cultural shock, or I guess you could call it a work-life adjustment for some of the staff, especially in our operations department. You can see in the first picture, we're all gathered around. We would meet like this every morning for our operations staff to discuss where we were going to be working at, go over safety protocols. But this was ingrained in our work culture. We would meet every single morning with our operations staff, weekly in our engineering staff. So meeting personally was a great way for us to communicate, keep up with what was going on across the district. And when this happened, that couldn't happen anymore. As you can see, one of our water treatment operators there, all by himself, that's a picture of him through the window, make sure that he could take care of his duties. We essentially set everybody home with a vehicle, say you're reporting from the field operations or the plant where you operate directly, and then if we need follow-up, we will contact you. So the safety briefings, no more. We determined to limit our interactions with all of our operators, and we were lucky enough that we could basically our treatment plants, our water plants, they're very small, so they could be operated with single operators. And then we would basically run in shifts or stagger shift for the rest of our construction crew. And no one was directly reporting in the office. We did our best to reach out to employees. We do have what's called Code Red, and to which we can call each individual employee to make sure that they know what's going on. And we use that on a weekly basis to give everybody updates on what was going on internally. We would also do personal follow-ups if people had questions. And then we also sent out a weekly email describing what was going on. It could say anything from, you know, hey, we're getting these face masks here, or it could also talk about what their work duties were going to be that week. So that was very, very helpful as far as to helping our operations. We basically had to modify all of our processes. We changed the process, but not the mission. And that's very important because although, especially at times, it seemed very chaotic, we were all focused on making sure that we had essential water and sewer services delivered to everybody. We found that some departments could adopt these changes very simply. I know our engineering department, they have incorporated Zoom meetings. They like it very much. One was just saying today, one of our engineer field managers was talking about how he likes these meetings because it's more convenient. You don't have to stand around and you can just get to work. So they've embraced working remotely. Then we also have our board meetings, which was very interesting because prior to this happening, by law, we had to meet in person and have those meetings out to the public. Obviously that changed, so we modified our process. We had to teach some of our board members how to use technology to join into our conferences. But now as we look into the month of at least through the rest of June, this is something that we're going to incorporate into our public meetings. So that was a big change to us as well. Now, a lot of questions. I know I've joined in on AWWA seminars regarding the financial impact to many areas. And again, I want to emphasize that this is a big question in many minds. Now, our finance and customer service team, they presented the following information at one of our board meetings recently, and as it is current as May 28th. And at this time, it appears that we continue to remain at least financially stable despite this pandemic. Now, keep in mind, we establish a yearly budget based upon our rates as our primary source of income. So at this time, our water and sewer revenue is currently over budget, and a lot could happen in the next year, but right now we're so far so good. Last year, our revenue was under budget, and we believe this was due to less water and sewer use, because less water use due to the heavy rainfall that we had last year. We also identified around $512,000 in expenses that can be delayed or cut, not hiring positions. None of our open house event was canceled for this year, minor equipment. And then we also had a refund from the Bureau's Workers' Compensation that helped out. We also cut an additional $135,000 in projects that could be delayed. And right now we have about $244,000 in pandemic expenses, anything ranging from labor, overtime, building sanitation, PPE, plexiglass, hand sanitizer, et cetera, et cetera. So even though we have accounted for and have those savings, if another pandemic or if COVID-19, I guess, comes back in the second wave that people are referring to, we'll be able to handle that. If not, we'll be able to get back into the swing of thing and begin our hiring again. Now, this is pretty interesting because a lot of people were concerned about how shutting off water services was going to impact the revenue. In our case, we need to have those collections for our revenue. So this was a very important part that we have been watching, and we're going to continue to watch as we still have the orders that we cannot shut off service. So far, we have not seen a major increase month to month as far as non-paying accounts, collecting those non-paying accounts compared to quote unquote normal. Now, I want to be very clear that this could change because people's financial situations are going to be changing, especially in the next coming months. So the trickle down hasn't even, there's no way to gauge that now at this time. So we recently ran a report that kind of looked at penalties over the past few months. and the numbers are interesting. We just took a small sample of our 20,000 customers, and we looked at the urban area of Rossford as compared to a more rural area that we maintain in Macomb and Hancock County. And as you could see, it's a good reflection on what's going around the district. And now if you look at February, this was prior to the pandemic. In Rossford, we have over 585 penalties that were assessed. In March, it went down to a more, I guess, normal for the area. Same thing in Macomb. You can kind of see their gauge right around 101. But then in May, when you looked at the penalties or people non-paying, the numbers, at least in Macomb, went down slightly, and in May, just above average, I guess, so to speak, even though there is no average when it comes to non-payments. This kind of gives us a gauge about how things are going as far as collections are concerned. And once again, these are just 2 areas that we maintain. So it's very important to point out that this doesn't get the whole picture, but it's kind of what we are seeing and reflecting in at least some of those changes. One of the things we had planned to prior to the pandemic even occurring was to work with the Salvation Army to start a program to build an emergency fund for customers who could not pay their bills. We looked at the city of Bowling Green. They have a similar program that we modeled this after, and there's also several other districts, areas across the country that have a similar program working out with the Salvation Army, into which they take the funds and allocate them to those who need with help with their utility billings within the district area. So we were able to start this program during the pandemic. I do believe we started it in May. And so far we have raised $28,000, all in donations from our customers. So this is something that has been, I guess, good to see a positive throughout the entire pandemic. We're going to look at what's next. We continue to report in the field. We continue to host remote meetings. We minimize staff interaction. We're obviously staggering shifts, and we're currently looking at our after incident analysis and either looking at getting ready for the next wave. But then we are moving forward to seeing what we have. So basically, right now we are kind of reassessing things, and then we are waiting to see what the next wave will bring. Hopefully nothing, but we're going to see this impact, I'm sure, for the next could be possible year. So we're going to be watching this very closely. I guess that's it. Any questions from anybody?
It's a quiet group today.
It's all right.
Thanks for sharing that, Teresa. $28,000 raised by people, for people in your area, in your region is pretty impressive. That's great to see.
Yeah, and it's going to be great to go back into the community, especially because right now people aren't concerned about as concerned as when they're approaching shutoff. So this is going to help as we'll probably see more people if we do see the shutoff order lifted in the area. So that's going to be something I think that a lot of communities are going to be watching, not only here, but across the country.
Yeah, and hopefully this is just an opportunity for the general public to become more aware of how critical water and wastewater services really are. And that's something that I think the industry always struggles with. So that'll be a positive momentum to carry forward with. Okay. Well, if no one else is going to chime in online here in the meeting, we'll move forward and go from there. And if you have questions, feel free to send them or submit them on the side, and we can come back again at the end. Next, we're going to hear from Cindy Geronimo. She's the Commissioners of Utilities Administration. She's from the Commissioners of Utilities Administration with the City of Toledo. We asked her to come and share with us about long-term financial impacts to our local government. So this is also part of our Utilities Administration segment here this morning. Cindy has a tremendous amount of experience with the city and our Department of Public Utilities. She's responsible for overseeing the operations of finance and accounting, legal and collections, and billing and records. She was also Commissioner of Code Enforcement for the Department of Neighborhoods and has over 29 years of combined experience working in government. So she can certainly give us some great perspective this morning. I was excited to know also, you learn something every day. She served as both a guardsman and civil service technician in the 180th Fighter Wing of the Ohio National Guard. She worked for the Lucas County Court of Common Pleas and was the chief deputy recorder in the Lucas County Recorder's Office. She also was director of real estate in the Lucas County Auditor's Office and executive director of the Lucas County Land Bank. So, among all those other things, she's also served the city of Toledo and Lucas County's planning commissions on numerous community boards, including ProMedica and the United Way. She holds a BBA, BA, and JD from the University of Toledo. So Toledo, tried and true, many years with the city. Thank you for joining us this morning, Cindy.
Oh, thank you. Thanks for inviting me. I'm excited to be here today just to share some information on what we've learned. You charged me with looking at what the long-term financial impacts to local government are. And, just to kind of give you some background, we serve about approximately 500,000 residents in 4 counties. It's about 7 million gallons of water is produced daily and used on a normal basis. So that kind of begins to kind of set the framework for how I want to kind of just use the city of Toledo as a model to show you what the impacts have been with COVID-19 to local government. So in order to frame that for you, I'm going to kind of walk you through where we were prior to COVID-19. We had spent some time putting together our plans for, meeting our objectives for 2020. And so these objectives that we laid out were to provide customers with the ability to control costs through conservation. We also wanted to shrink the amounts they were paying, have them pay monthly as opposed to the quarterly system that we were on. We also, looked at ways that we could just preserve neighborhoods and family coherence by reducing, the amount of shutoffs we would need to do. Also connecting customers to available community resources was really important to us. So in order to meet these objectives, some of the things that we did is we spent like 2 years really putting together an inclusive affordability program. And these things included, like I said, shifting over to monthly billing, which was a huge project in itself. And, with that, you always run into all of these additional things that pop up, like government is notorious sometimes for not updating software. So we ran into some issues where we had to move our software to a new hosting environment, and that had its challenges all by itself. So just moving to monthly billing was like a big task for our staff. So we were already kind of, we already felt like we were being challenged on a daily basis, and we were having to be flexible and really tap into resources. So that's how we've spent the last 2 years. So, like I said, we were looking at ways that we could make water more affordable for, our customers. And, that was one of the things we looked at, is eliminating the minimum water charge. So prior to this year, we were charging people across the board for 2,000 CCFs, whether you used it or 2,000 CFs, whether you used it or not, you were paying for that. And so we thought, okay, let's eliminate that minimum water charge. And now people will actually just pay for what they use. But with that, we wanted to make sure that we educated them on conservation and ways to reduce that bill. We also had a couple of different discounts that we could offer: the senior discount, the low income, which is an additional 15% just on the water portion of your bill. They also, we put together a utility bill assistance program, which we were really excited about because that gave us the opportunity to really leverage our relationships in the community. So we reached out to places like ProMedica had the Financial Opportunity Center, and we partnered with them. We had already partnered with the Salvation Army. We had, because we have an outreach person too that on a daily basis spends time out in the community and listens to what our customers are telling us. So we spent time really thinking about how we could, just build that resource center for our customers. And then, with that too, they offered financial coaching. So like I said, we had really worked on putting this affordability plan together, and I did think it really helped us in like priming us for, you never know what's going to happen. I think that's the biggest thing I've learned through the years and in working in different organizations and overseeing operations is that you have to build really flexible plans. You have to anticipate, you just never know what's going to happen. I mean, prior to this year, last year we had a couple power outages, and like I said, we had this whole issue with moving to a new hosting environment. And so we were having last year, because of some power outages, we had to work remotely. So one of the things that we ended up doing is getting more people transition to laptops, which I felt like was so timely, because as we went into 2020 and like I said, we started out the year with all these plans, and then we had to be flexible. So it was really great to be able to know that we had a number of us that could work remotely. And then the challenge was getting all the other staff members to be able to set up to use their home computer. And also, a lot of management had the laptops, so that worked out really well. And so, once we were into COVID and we were evaluating, how are we going to kind of navigate through this? And so we quickly, our finance team is always looking at, where we are with our budget and with our revenue collection. So we do that on a regular basis. On a monthly basis, we sit down and kind of analyze that. So what we did this time was we, after that, as we entered into this, we looked at, we brought in the City of Toledo's finance team to work with our DPU finance team. And then we also have, an outside advisor that we use, PFM, who we brought them in to have a conversation about, let's really look at the impact that this is having on us and how can we begin to build a plan here. So we looked at consumption, because consumption is the driver of revenue for water and sewer. And so with that, we were able to, look at, like, January, we were doing pretty well. Like I said, we went to monthly billing and we actually had brought in more revenue that we had budgeted for January. But then we got into February, March, and April, and we saw like it was averaging about a 15% reduction in consumption. And, we had to really kind of look at, how do we really gauge this? And I think, you use the old adage, you prepare for the worst, but anticipate the best. So that's essentially what we did. We looked at, if we had a 10% reduction in revenue, a 15, a 20, and how do we make up for those lost dollars, and what do we do at that point? So, in order to make up for lost revenue, we had to really look at where we could do some cost savings. And that meant, doing some temporary emergency leaves for some of our employees. And also, we took another hard look at our budget, and, it's 5% reduction on non-labor items. So we, quickly assembled that information together and put that in place so that we could show where we could make up for those lost revenues. And then, like I said, we kind of scaled it out so that we would be prepared for whatever level we reached. But we really felt that, that February, March, and April was our hardest hit time. And as we started going into May, we could see that, as manufacturing and commercial, as people were returning to work, there was an increased demand in water. So, and also too, like, people sheltering at home. So as people were sheltering at home and the weather got better, people may have been filling up pools, and they were watering their, I know I've been watering my yard a lot more because you spend a lot of time there. So we felt good in the sense that, we know we had been impacted, but we started to see, we were climbing back up. So normally, like I said, we produce about 70 million gallons daily. And, most recently we've kind of been in the 60 million gallons per day. So that's been, a good indicator for us. as Teresa mentioned earlier, we continuously are looking to see, how do we keep measuring the impact it's having on our residents? And we're looking at, we're under that shut-off moratorium. So, we're having discussions about how to, what happens after that moratorium is lifted? What does that look like? But then too, you've got to kind of premise that with, you don't know what's coming down the pipeline. If there is this second wave, then, we have to quickly adjust. And so, we're kind of continuing to build a very flexible plan there. Also, we're looking at the number of customers that have, hit shut off dunning level. And, it's been like, we have approximately 2,500 people that are in that level. It equates to about $2 million. And I think those numbers are important. We're actually taking a deeper dive into that data because we want to be able to figure out, like I said, we built a bill paying assistance program. And when we relaunched that program after the shut-off moratorium is lifted, we want to make sure that, we provide the most help we can to the people that need it most. And I think that the data is the key for that. So we have to look at the data in order to determine, like, how do we ensure, because we've got $500,000 a year set aside for that program. And, unfortunately, because we only had the program in use for the first couple months of the year, we used almost $28,000 of it. So we have quite a bit left. But what we've been looking to do is really determine what the need is in our community and how we can help the most people. And then we're keeping a sharp eye on any funds that might be available that could be leveraged to, again, help as many people as we can. And so we also, we're reviewing our installment plan guidelines because we use a whole host of tools in order to help somebody, be able to keep their water on. So again, it's educating people on the discounts that are available and, the fact that they can conserve water and it could result in a smaller bill for them. We're continuing to look at, other IT developments that we could, to give people more information, eventually like customer portal that they'll be able to use. So, we're really committed to just continuing to make water affordable for our customers. And again, I guess the big key, the thing that I've learned most is that we just got to continue to build really flexible plans and just, keep your ear to the ground and really listen to the needs of the customers that we have. And with that, that is the end of my presentation.
That's
Any
great.
questions?
Thanks so much for sharing all of that. It's great to see that the city is really obviously concerned with its community and its citizens and making sure everyone has what they need to stay healthy as possible during this outbreak.
Thank you.
Yeah, I'm so glad you could join us and share that with us this morning. I had not received any additional questions, but I may actually, in true roundtable format here, turn the tables. Is there anyone that's joined us from other than the city of Toledo that's had impact of the utilities funding being restricted just based on a decline in consumption? And obviously the moratorium right now with water. Does anyone else want to share how that's impacted their community or things that you've had to do as an impact? Can be kind of a touchy topic.
Right.
Well, we'll save some more Q&A for the end. Just in continuance from that discussion, it's a nice segue to talk to Patika Bannister is joining us also from the city of Toledo. She's the Commissioner of Plant Operations, and we asked that she share with us some ideas and learning on some things that they're looking at with utilizing wastewater as a regional public health surveillance tool. So Patika is the Commissioner of Plant Operations, and she's been doing that since 2017. She was, prior to that, working in industrial pretreatment and has worked in a lab. She's also oversaw the stormwater services in the past. and she's done a lot with consent decree work. So naturally with that, she handles a crisis very well. So the city's lucky to have her, and I'm going to turn things over to her so she can share with us potentially looking at kind of surveillance and early warning systems that could be utilized through the wastewater operator system. Thanks, Patika.
Great, thank you. I'm also trying to share video. That's not working well for me yet this morning. As she mentioned, my name is Patika Pope-Bannister, and as Commissioner of Plant Operations, that means that I oversee both the drinking water and wastewater facilities for the city of Toledo. Okay. For anyone that might not be as familiar with both our drinking water and wastewater facilities, you can see here some data that we have for both our plants and our water and sewer lines. We have approximately 680 employees in the City of Toledo Department of Public Utilities. We work diligently to make capital improvements in a timely manner. We are a citizen engaged utility, which uses technology to enhance both operations and customer communications. And Cindy gave you some insight on what we've been doing since the COVID-19 and coronavirus on customer communications and how we've had to make some changes. We have a culture of innovation, and we value research. We have research projects going on at both our drinking water and our wastewater plants. I'm sure that you have all heard that in our communities we have 3 different groups. We have people that are asymptomatic, we have people that are infectious, and we have people that are non-infectious. And these individuals are shedding. We have reviewed research in Amsterdam and Paris that indicates that sewage surveillance could be a sensitive tool to monitor the virus within our population. You can see here I've provided kind of a definition or a background of what sewage surveillance is. This genetic material that's in the waste product is detectable through qPCR, and there are different types of qPCR. The RT-qPCR is what we were using in our first evaluation of our samples, and it looks through for a DNA and RNA sequence. So it's finding the virus within the RNA sequence. For those of you that are familiar with drinking water and our HABs, qPCR is a method used in HAB analysis. And this is the same testing that fans of NCIS might be familiar with. You might hear some reference to qPCR. We were approached initially in March when the coronavirus first started really affecting our region here, as far as looking at some of the things that Teresa was talking about with how we're going to handle operations as municipalities and as public entities. And at that time, we were not quite ready to look at sewage surveillance. We were approached again in April by the health department director, Eric Kaczynski, and he sees the surveillance as a tool that he can use along with clinical surveillance. So he was interested in seeing what the 3 plants in Lucas County we're seeing in our influent and our effluent, and that those 3 plants are Lucas County, Toledo, Bayview, and Oregon's plant. So what I call round 1 began in late April. We utilized the University of Arizona's Water and Energy Sustainable Technology Center. Within much discussion, we went with one influent and one effluent sample from each one of the plants. We really had to look at things like holding times, when was the best for each operation, because we have different plant operations within the 3 plants. Holding times for non-frozen samples are 72 hours. And after that time frame, you have a 99.9% loss of being able to find being effective in finding the virus. So getting samples to Arizona, meant us having to pack down samples, ice them, and ship them in coolers to Arizona. Round 2 sampling, as we're doing the sampling with University of Arizona, we are in talks with our local universities, Bowling Green State University and University of Toledo, to look at how we can bring sampling to our region that was more convenient, that could understand the challenges that we had, and was familiar with our area, our population. And they began working on a plan and ramping things up. And so last week, we took some of our samples that both plants had taken previously. So it's a split with the samples from University of Arizona. And we delivered those to University of Toledo, and we will begin sampling. We are looking to sample into next year. We want to provide the health department in our local area with some confidence. We initially had 3 objectives with our sampling. It was to provide insight into the presence of COVID-19 and the monitoring of our wastewater to quantify any potential risk of infection to our workers. Also, any removal of the virus by our treatment process, which is why we chose the effluent sampling. And I can confidently say, and you'll see in my my next few slides here, I can confidently say that all 3 plants displayed an ability to remove the virus by their treatment process. Round 2 sampling that I've mentioned includes split samples. Based on the results from the University of Arizona, the group decided to discontinue the effluent and focus on influent. All 3 plants have different sampling days and times, so we really needed to focus on sample design, collection, and storage. We are very fortunate to have a native Toledoan that reached out to us through Tom Henry, the Toledo Blade, Dr. Joe Catrubo. He has been providing expertise to us as well. The city of Toledo will be sending samples to his lab, Cosmos ID, to analyze and continue to help us through this process as a region. And our goal is to merge University of Toledo and Cosmos ID, their expertise. If you're not familiar with Cosmos ID, they are international experts in drinking water and wastewater analysis, looking at the samples of the water for RNA, DNA sequencing to determine different types of viruses that are in water, and helping countries internationally being able to create a warning system for them. So they're internationally recognized for doing that type of work. Frequent conversations within plants and researchers for optimal locations to sample continue. We have in the city of Toledo, we have a number of industrial users that may have waste streams that could cause interference with the testing procedures. We have identified through talking to University of Toledo and Dr. Catrulo that 2 interferences that we are aware of are our septic hauler program and the use of ferrous chloride. So for the city of Toledo, we have a specific day that we notify our septic haulers in advance that we cannot accept their waste, and we have to discontinue the use of ferrous chloride. So those 2 things combined, and then we are able to take the sample. And that's why it's difficult for us to be able to take multiple samples, and samples daily because of these 2 factors. So you can see here the results that we saw that we received from the University of Arizona. The first sample that we sent was a sample April 22nd, and you see here that the sample was negative for influent and secondary effluent. All the samples that we sent were negative for secondary effluent, and that was true for all the plants that sent samples, and that's another reason why we've decided just to focus on the influent, because this test basically told us that our processes are tried and true and are working properly. You'll see on February 9th that one of our influent samples was positive, and it had 1 NRA target. The N1 was positive. They tested for 2 CDC primer sets. It's N1, N2, and N3 are the primer sets. They tested for N1 and N2, and N1 came back positive. So their assessment is that the virus is present, but it's present at a low level because it was only seen in for the N1 primer set and not in N2. As far as communication, this is something that was still a work in progress. As I mentioned, we just ended our sampling with University of Arizona and are just getting the results back. And we're starting to work with our local universities for laboratory analysis. So now we're going to begin the communication process. So when we receive the test results, the health department receives them also, so that they can then use this as another layer to their existing data. And Chuck mentioned that we see ourselves as public health workers and can provide that additional layer of information to the health department, and they can then use this as a tool. We are working out with University of Toledo and Cosmos ID and try to dig a little deeper on our analysis and testing results so that we can be prepared if in fact there is a second wave, that we can notify the health department and they can begin to prepare, that they're not just using data sets on the clinical side from emergency room data or hospital visits, but we're creating an additional layer. We on the water side, we have gotten our HABS analysis communication program well established. So we know how to do that outreach and provide that information. So this should be something that we can quickly turn around and provide information to the public. so that they can also prepare for another wave, so that people are not caught off guard and rushing to our local retail establishments to buy up all of the paper products and meat and dairy products in the store, that people have enough time to prepare for those types of things. So really, that's just quick. As I said, this is a rolling process right now. There are a number of cities that are beginning to do the same type of analysis and work, and we're all trying to figure this out together. I did give Kari a link to the Water Research Foundation. They have archived a presentation, a webinar that they put together April 27th. All of their handouts and webinars are available on their website. If anyone is interested, any communities that are interested in having analysis taken at their plant, please, you can notify myself here at the City of Toledo or TMACOG, and we will get that information to the University of Toledo, and we can begin helping you with developing your own strategies.
That's great. Thank you so much, Patika. It's wonderful to know you guys are really helping with the forefront of things. Obviously, it is a new challenge for all of our communities. And so to be doing that work and working with Cosmos ID and know that that's in progress is really hopeful. Obviously, we all in the industry have recognized that we are public health workers as much as anything on the wastewater and water side of the industry, but this puts a whole nother aspect to the potential of being able to really keep people safe and an advanced warning system with the surveillance. So that provides a lot of hope to know that you guys are doing a great job kind of paving the road for future initiatives. So thanks for sharing that with us. Did anyone have any questions in regard to specifically that segment? I hadn't seen anything come in, but I know we're going to be wrapping up pretty close to our end time soon. We did have a question come in that may be more appropriate for Chuck or maybe even Teresa for Northwest Water and Sewer District. If anyone could share a response to this question. There was a question around what type of precautions are being used by sewer cleaning and inspection crews. What are communities doing for sewer camera cleaning? Those two are kind of interrelated. If anyone could speak to that, that would be wonderful. Chuck, are you still on? And Teresa, you probably have some perspective from that from Northwest as well.
Yeah, as far as with our sewer crews, I mean, I've seen them in their full suits going out and getting some samples. It just depends on what they're doing day to day. I know that they take a lot of precautions as far as, you know, the standard safety practices that they already have in place. So to have anything major that was a big change really wasn't too much of an issue. Same thing with our camera truck people. We just provided a lot of PPE and just, you know, just constantly reminding them to be aware, to be safe. But then again, they already were to begin with, because I think that's something that, you know, as an operator that you have to be responsible for.
I
If that
think
makes
everyone
any
should
sense.
become more aware.
Yeah. Oh yeah. And you know, it goes back to, I would hear some of our some people in the hallways say that, oh, you know, we already do this. This is what we do for a living. Don't you, you know, we do this. Okay, we've heard it. But it never, with anything safety related, it never hurts to hear it again.
Right.
Chuck, have there been any differences from any of your team on sewer cleaning and inspection precautions? Oh, your sound isn't coming through.
I can answer for a City of Toledo perspective. we utilize, in the very beginning, we worked with our safety team, and I see some of them are on this call right now, or on the video right now. But we began looking at, what additional PPE did we need, and we found out that it's this PPE that we require our employees to use. But the problem was it became a little more difficult to procure that PPE. So then we worked with the state. We talked to Ohio EPA. They did have a group of drinking water plants that they worked with, and we let them know that yes, we are having difficulties trying to purchase some of our PPE. We had people that traditionally we had to beg them to maybe wear gloves. Now all of a sudden we're wearing gloves, and people are washing their hands more. So we were going through more of our PPE, and there was a time towards the end of March, beginning of April, where it became difficult to procure gloves. So we had to work on strategies for glove usage, and people, we normally would distribute a box per person, and then we had to reduce that to maybe their daily amount of gloves to make sure that we had enough for the duration, because we didn't know when we were able to order gloves again. So, so yeah, I think the biggest challenge for us was procurement of the equipment, but we have people that wear safety glasses, and we had plenty of those, gloves, soap. We did have to order some additional wash stations for people that were in water distribution and sewers. We had to make sure that they had some mobile hand washing stations. We were able to order some camping type equipment with soap and water when we were not able to buy hand sanitizer. Our drinking water lab had some of the chemicals to make that, and so we did make large batches of hand sanitizer.
That's great. I know some of the local breweries in different regions were doing some of that too, which was awesome to see the all in this together spirit. We had one more question come in that we'll sneak in here before we wrap things up. Patika, how will the information that you discussed help predict the next wave?
So that's what we're working with now with Joe Catrubo and the University of Toledo and Bowling Green. We're setting the baseline of what we saw in April and May and starting to look deeper at some of the trends. And we are going to continue sampling. We're predicting until around March timeframe of 2021. And as we start to see, as each of the plants are starting to see their levels of the virus increase, or maybe we might have some times where again we might see some negatives, and we do a little additional sampling and find out that in fact it is negative and there is no coronavirus. When we start seeing something again, because each plant we're sampling at different times, so we don't just have Toledo doing their sample on, say, a Saturday. We have Lucas County that might do theirs on Wednesday. We have Oregon that's doing Tuesday. So we're getting at least 3 days out of that week of what is going on in our region. And as we start to see as we start to see more positive results coming from all the plants and our numbers increase, then that is an indicator to the health department to again start looking at some of that other data that might be coming in. So we're working on matching what the health department is seeing with patients in the area with what we're seeing in our samples. I think there was a question about costs that I want to mention. For the University of Arizona sample, they were $350 per sample. And that's another reason why we wanted to look at sampling locally. Working with the University of Toledo, they're able to get that cost down. And we've been talking to a number of different funders on how we can expand our sampling and lower the cost.
And there was a question also around, is Lucas County and Oregon continuing to test throughout the year?
Yes, all 3 plants have committed to assisting the health department with this analysis.
That's great. I know that we've seen some other clients across the tri-state region and others in the country that are getting involved in this, as you referenced as well. So hopefully between WEF and some of the other organizations, they'll start to look for some maybe even early indicators, or we can know what's happening in other cities that might be reached before our region as well. So sometimes it sounds a little overused, but truly the all in it together, the more regions we get involved in these things, the more we can all benefit. So thank you for your active leadership throughout this trial that we're all running through together. I know we're running, it's already 11:35, so we're probably a little over. It's great to see that so many people could join us this morning. I hope that if you have any other questions, you would all feel welcome to send anything in to TMACOG. If you go to their website, there is going to be the resource page. And Kari, if there's any other information that you'd like to share on behalf of TMACOG to wrap us up, that would be wonderful. Thanks for having all of us this morning.
Great. And Sarah, thank you for your excellent job moderating this discussion. I think it's a really important one for the region. And I'd like to thank all of our presenters today for taking the time to present on how you've been addressing the COVID crisis. And to all of our attendees today, thank you for coming. A few things to note, as Sarah mentioned, this information and all of our presentations will be available online. And I will follow up with all of you if I have your email address to make sure you've got a link to that webpage. This is also being recorded, so the entire program will also be available eventually through a YouTube link. Finally, I would like to remind all of you that we do have a webinar series launching on Thursday. Our first presentations will be on PFAS for drinking water, so Ohio EPA will be presenting on Ohio's PFAS drinking water plan, and we'll also have a presentation on wastewater considerations for PFAS. So there will be a registration link on the webpage that we will be sending out, and you can also access that information through the main TMACOG webpage. So encourage all of you to join. If you are a TMACOG member, we do have a discount code so that you can register for that event for free. If you have any questions, please do feel free to reach out to me. And finally, Chuck did mention that we are willing to put on additional webinars. So if there's anything that you heard about today that you would like to hear in more detail, that you think would be useful to operators of both wastewater and water systems, just shoot me an email, let me know, and we'll see if we can get together some additional presentations. So with that, again, I'd like to thank everyone and Jones and Henry Engineers for your sponsorship. Sarah, thank you so much for helping to facilitate that. This is the only reason we're able to put on these webinars this month, so we really appreciate that. Thank you, everyone.
Thank you, Kari. Thank you, Sarah.
Thanks. Have a great day, guys.
Thank you all.
Yes. Thank you.